My name is Jessica Vickers, and my project is on domestic violence. The test question I have are what are the 5 physical tests used to determine the common mental health disorders and standardized questionnaires. My article that I chose from was called The Longitudinal Measurement of Cortisol in Association with Mental Health and Experience of Domestic Violence and Abuse. The summary of the article is that this article is about how domestic violence tends to happen to women more than men. It is more focused on women and how cortisol levels increase or decrease depending on the type of mental illness. It is developed after the domestic abuse, whether it's physical, emotional, sexual, or psychological. It also talks about childhood abuse that women were exposed to, and the levels of stress and mental health amongst the study of 5 psychological tests. Domestic violence and abuse, or DVA, is classified as a chronic syndrome with physical violence as well as emotional and psychological abuse. DVA has a relationship with mental disorders and an increase for depression, anxiety, psychosomatic disorders, PTSD or post-traumatic stress disorder, alcohol abuse, and suicidal behavior. Cortisol is a steroid hormone that maintains stress levels. Cortisol production starts when you wake up and slowly decreases throughout the day and usually is gone by the time you go to sleep or around midnight. Chronic stress can increase or decrease cortisol levels. For example, women with PTSD, post-traumatic stress disorder, tend to have lower levels of cortisol, while those with anxiety and depression have higher levels. With the standardized test questionnaires and the psychological tests, these are the 5 questionnaires that the participants of the study answer. The first one is Generalized Anxiety Disorder Scale. This is used to diagnose generalized anxiety disorder. Number 2, Patient Health Questionnaire Depression Scale, and this is used to diagnose depression. 3, PTSD Symptom Scale, and the DSM-4 symptoms which DSM-4 symptoms are shown within the last 2 weeks. The DSM-4 is a handbook that has all the disorders and what to expect or what experiences you're expecting to have when you are being diagnosed with a specific disorder. 4th, Sheehan Disability Scale. It's an access to access functional impairment in work, school, social, or family life. And number 5, Perceived Stress Scale. It's a perception of stress. How this information will help my career. My career choice is to be a mental health counselor. I think that knowing this information would help my career path because some mental illnesses are developed from domestic violence. Trauma plays a big role in depression, PTSD, and anxiety. It would be good to understand the root of the problem and how to work through the challenges faced after developing these disorders. Suggestions for families. I would say to utilize the National Domestic Hotline, learn to understand abuse and recognize the signs of abuse, understand why she stays or the victim stays, and how to help her or the victim if she leaves the relationship.